Hello, I am Dr. Satyaprakash Mahajan, consultant dermatologist practicing at Rudranshu Skin and Eye Care Clinic, Nashik, Maharashtra. Today we will discuss about a commonly presenting topic, herpes zoster. Herpes zoster, which is commonly known as shingles, is a viral infection that leads to occurrence of a painful rash and blisters in a certain stripe of the body. Although it can happen on any body surface area, the most common sites are the forehead and the truncal region. Herpes zoster occurs as a result of the reactivation of a dormant varicella-zoster virus in the dorsal root ganglion, which may have been acquired from previous chickenpox infections in the past. The reactivation of this virus is usually preceded by an event of immune dysregulation, wherein a loss of countercheck mechanisms on the dormant virus may have become ineffective, leading to opportunistic growth and spread along a certain nerve innervating a dermatome. Predisposing conditions for herpes zoster may occur in subjects with a weaker immune system like elderly, HIV disease, organ transplant recipients, chemotherapy patients, poorly controlled diabetic patients, stress due to physical exertion, trauma or systemic illness. The earliest symptoms are lancinating pain or burning dysesthesia along a dermatome, followed by appearance of a grouped papulovesicular rash atop a red background after 2 to 3 days. The affected skin is usually more tender than the normal skin. The rash is classically unilateral and mostly monodermatomal. However, satellite lesions can be seen on adjacent dermatomes. Rare cases where immunity is grossly suppressed may present with a multidermatomal involvement and severe hemorrhagic blistering. The rash usually continues evolving over 3 to 5 days, and thereafter the lesions start crusting with healing over 2 to 3 weeks. Since herpes zoster is an affliction of the nerves, most often the condition is followed by postherpetic neuralgia. Postherpetic neuralgia occurs more often and with more severity in the immunosuppressed patients. Diagnosis of herpes zoster is clinical, done by examination of the affected area, which shows a pathognomic dermatomal distribution of grouped papulovesicular lesions on an erythematous background. At times, patients may present in later stages with a picture of crusted lesions in a dermatomal distribution. One needs to understand the importance of early detection and treatment of herpes zoster in an effort to alleviate the chances of postherpetic neuralgia. Patients should be made aware of the possibility of postherpetic neuralgia and its impact on quality of life. Also, they should be dissuaded from quackery that still occurs large and loom regarding this condition and bust their myths. Management of herpes zoster involves pharmacotherapy and parallel care for reducing the discomfort arising out of the condition. Dermatologists, being properly trained in this field, are better ones to manage herpes zoster and prevent complications. Early institution and proper dosing of oral antiviral medications is the key to reducing the chances and severity of postherpetic neuralgia. Additional measures like cool compresses and painkillers may help alleviate the associated pain. Untreated zoster may lead to complications like postherpetic neuralgia, secondary bacterial infections, scarring, nerve palsy like Ramsay-Hunt syndrome, or severe ocular disease in the involvement of the nasociliary branch of the ophthalmic division of trigeminal nerve, and also encephalitis. Fortunately, preventive measures like vaccination are available for herpes zoster. The CDC recommends 2 doses of recombinant zoster vaccine Shingrix to prevent shingles and related complications in adults 50 years and older. The Center for Disease Control CDC recommends 2 doses of recombinant zoster vaccine RZV to prevent shingles and related complications. RZV vaccine is also recommended in adults 19 years and older who have a weakened immune system or because of disease or therapy. I hope I have been able to give you an overview of herpes zoster and identification and management at early stage. If you find this video useful or for more such videos, check out the website dermavidya.com. As a doctor, my advice for any skin and health related issues is do not self-medicate. Please get in touch with an expert dermatologist near you. Thank you.
For more such videos, visit or log into dermavidya.com.